Executives from leading organizations have convened at the Becker's Health IT conference in Chicago this week for discussions about the most pressing issues facing hospitals and health systems today. Sanford Health Chief Information Officer Brad Reimer is there, and he joins us to tell us more. Brad, thank you for being with us.
Yeah, I appreciate it.
So tell me about the dialogue, Brad, that's taking place in the world of health IT and digital health strategy, and just some of the conversations you're having.
Yeah, so there seems to be a couple main themes that everybody is kind of centering on. Obviously, information security is always one that's top of the list for a lot of people to talk about, but then a lot of discussion around just what's happening within the workforce, both the clinical caregiver side of things as well as the IT workforce and availability of talent, and what that pressure is doing, and how do we really partner with other organizations and universities and those types of things to start to bridge some of that care gap and some of the gap that we have in filling the talent pipeline. And then there's also a lot of interest that was a little bit surprising. There's a lot of people asking a lot of questions around what we're doing with rural health. And there's some larger health systems that it's maybe not the majority of what they do, but they know that they have a certain portion of their patients that are in a rural setting, and they're looking for somebody that has best practices around that they can partner with and share and learn from.
And now you have participated in 2 panels so far. The first one this morning focused on strategy, innovation, engagement, which is a timely topic here at Sanford. What were some of the insights that you shared during the discussion, and any key takeaways you'd like to share?
Yeah, so everybody's talking about what's happening with digital health and virtual health, but it seems like there's this pressure to insert technologies like that into the care stream without really understanding the true benefit that it's going to bring to the care journey for our patients. So the discussion that I've been trying to turn the tech conversations to is, how do we make sure that the patient's in the center of that? And it's the patient needs that's driving where we put our investments into the technologies to make it better for them.
You've said the battle for talent in healthcare is broader than physicians and nurses.
Yep.
Talk to me about that and some of the things you're focused on as CIO at Sanford Health.
The problem definitely is broader than just within caregivers and the nursing community. The impact of just how much technology is advancing and the number of new technology roles that are needed, not just across the U.S., but across the globe, is driving a shortage in IT talent, especially around areas like information security, digital tools, data, AI, and some of the advanced algorithm type-based technologies. And when you look at the number of students that are coming out of universities and graduating with those degrees versus the global need for that talent, the math just doesn't add up. We're not training enough new people into those technology skill sets that are really going to carry us forward. So we're talking about things like the partnership that we've been really pushing into with Dakota State University, and how we're able to bring healthcare into the university setting and getting them, some of the students, attracted to healthcare and a profession that has a deeper meaning and a deeper purpose in life, as well as taking some of our clinicians and some of our tech staff that have been in the health system for 10 or 15 years and bringing them up to speed on some of the latest technologies, and trying to figure out how do we make the technology actually give us an advantage to where we maybe don't need quite as many of the true deeply technical skill sets down the road, so we can fill the gap of where the talent shortages are.
And lastly, now the future of healthcare is digital, as we know, and specifically at Sanford, improving that access and care for our large rural footprint. Brad, as you think about the conversations taking place at the Becker's conference this week, what excites you the most as we look forward to the future?
What excites me the most is vendors are starting to talk a lot more about providing simple solutions, easy to use solutions. It seems like the last couple of years, as AI has become more of a thing, digital tools, remote patient monitoring, we've maybe made it a little bit more complex than it needs to be. So the fact that vendors are recognizing that, and those providing the technical solutions, if they're looking at it from a patient-centered view, what's going to make it easiest for them? What's going to make it the quickest for them? What's going to make the experience something that's more fluid and doesn't feel choppy? So it feels like vendors have really started to embrace the patient centricity around the way that we're delivering digital tools.
Brad, I really appreciate your time and all of your insight from Chicago. Thank you.
Yep, thank you very much.